So, do you see a lot of plant-based patients? And if so, how do they do? And what do they get wrong about implementing a plant-based diet?
So I do see a lot of, I mean, and that's actually been increasing just over the last 5 years, right? So even though, we've been plant-based since 2006, it's just because of programs like this, and books and movies and the game changers and things like that, and forks over knives and all those kind of things, right? Which we actually had a little part of the game changers aspect. But yes, I do see a lot of plant-based, but what they all don't understand is that I give you a classic example. So 3 weeks ago, I had a guy came in and he's super plant-based. He's a type A personality, fitness, kind of hardcore, like, he's like a fun manager, like he's a kind of finance guy, right? So like bam, 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 like just checking all the boxes on, and a super hardcore. His diet is impeccable. Not only is organic everything, but he's like hardcore. Like he's seen the little wheel and he's checked off like, like here's how many grain seeds. So like literally, and to be honest, for me, I was almost like, okay, this is too much, because, I will eat occasionally packaged food that's plant-based and, blah, blah, blah. Fine. I'm not perfect, right? I don't eat animal protein at all, but, and I'm not 100% whole foods. This guy was 100% whole foods, right? And I'm like, okay. And he had no gut symptoms. His gut symptoms were daily bowel movements, 3 bowel movements, well-formed, banana shape, blah, 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 no symptoms. And then we did his nutrition test, and his nutrition test was terrible. It was all moderate to severe deficiency. And I'm like, well, how is this possible? That means he must have some kind of malabsorption syndrome or something wrong with his gut. We tested him. His leaky gut was one of the highest off the chart that we've ever seen. Yet he's so healthy otherwise because he's eating all the right things that he's not really symptomatic of having gut symptoms, right? So there can be mismatches where people just are not, like he's still feeling tired. He's still feeling a little this. It's like, yeah, because he's not absorbing those nutrients. A lot of people also who just moved to plant-based are not eating enough plant-based foods. That's the biggest thing that we'll see across the board, is because when we remove the animal protein and the rest was like the sides, right? We would call it in an American meal. They didn't know how to make the sides the main. It's like, so a lot of people like, I'm eating a little bit, but it's like, no. You need, 50 grams as a female, 60 grams as a male of protein a day minimally, and 30 grams of fiber, right? If you get to those goals, you'll start doing really well. The problem is most people, when they shift over, they have not learned that they need to eat more food. Remember, it's low calorie food. So most people will lose weight on a plant-based diet, but the idea is that we also have to make sure that they ensure that they're eating enough.
Okay, so you find that now when you say eating enough, is it variety? Is that what you were saying? That
yeah, because we look at when we look at the testing, and also when we look at the microbiome, for example, it'll tell us like certain species, and there's ratios of species, like Akkermansia species, and most people are not eating enough what they call phytonutrients, color, in their diet. So what happens? A lot of people eat a lot of the same things. I'm just as guilty, by the way. Okay. So I always tell my patients, I'm as honest as anybody will get. I'll tell you what's good, what's bad. I'll tell you what are my vices as well, because it's a journey. Life is a daily practice. Someone comes and say life is good, and I used to do that. That's usually a sell. I always, that's a red flag for me. It's like, look, so I'll tell you this. I have my 2 favorite greens, my 2 favorite grains, my 2 favorite beans. I can eat a vegan taco like 3 times a day. Okay. So but it's not diverse. You need to make sure that you're getting diverse rainbow colored foods. I may not be able to say that in Florida, but rainbow colored foods is what we need. So all the phytonutrients, all the reds, yellows, greens, blues, you see that little rainbow chart that they usually show, like on the nutritionfacts.org and the PCRM, they'll show those kind of things. You can download those things, charts. So reds, yellows, greens, light greens, purples, blues, all the different legumes. Every color phytonutrient actually increases microbiome diversity, also has anti-inflammatory effects indirectly. Antioxidants are actually anti-inflammatory secondary actions. So sometimes it's like we just got to increase that, the absorption, the improvement of the intake, and their inflammation will go down from another level just from the food.
Great, thank you. So you mentioned that you have a YouTube show about healing spices. What should we be taking daily?
So I would have you go to YouTube, type in Chef AJ and Dr. Pai. We do a monthly show. I'm taking a book. There's a great book that you can get. It's not mine, but I don't mind promoting someone else's book because it's a great book. It's called Healing Spices.
Okay.
And Dr. Agarwal is a famous researcher, scientist. He used to work at MD Anderson in the cancer therapeutics division. He actually discovered many pathways for a lot of biological drugs that are used today for cancer and autoimmune diseases. His pastime with his 100 postdocs was actually looking at all the Ayurvedic Chinese herbs and spices and actually analyzing them for physiological benefits. The book is great because it takes them through spices, from the historical use from all over the world, different cultures, to how you need to store it, to how you should buy it, the different forms of it, and then gives you a couple of examples. It's not a plant-based book, so I always tell people just take out the animal protein and make a plant-based protein and substitute in the recipe. But that's how you need to learn. There's not just a single spice that everybody should take, but what you'll learn, here's the challenge, and it's something that I will say, since I'm going to be on the panel tomorrow night with other plant-based doctors, is that my biggest kind of issue with the plant-based movement here in America is that the diets that we prescribe or recommend to most people, at least from my perspective, my opinion only, is it's quite bland and boring, right? Because a lot of people, again, no fault of their own, it's like meat and potatoes, right? They grow up with meat and potatoes. So we take away the meat, now we have potatoes and some vegetables. So then it became like kale and quinoa and 3-bean salad. And that kind of, became the salad. But I'm not here to teach people to eat salad all day long. I don't think that's appropriate. People need to eat what they're used to eating, just they need to eat it plant-based. So I should make vegan enchiladas. I should make, vegan spaghetti. I should be able to eat plant-based Thai food or Indian food or Mexican food. Right? So I eat a variety of flavors and foods. And a lot of people are afraid of spices because they think it's spicy. And when you learn about the book or we listen to the videos once a month, and I'll also have it on our own channel. We're having our podcast coming out in the next couple of weeks. We'll do a weekly show. Is that, and we'll show recipes and we'll do some cooking classes as well online. It's like, these are things that you incorporate daily. And so you'll see that a lot of these foods help with heartburn and reflux and this and that. And yet the average person has heartburn and reflux because they're not eating the foods that actually help their digestion or help their issue. We just end up taking drugs that are treating symptoms and not actually improving the physiological aspects of health.
Okay, thank you. Are there plants in the the plant-based diet that should be avoided that are pro-inflammatory properties?
No, but there is when the patient tests positive for the plant on a food sensitivity panel. So that's where when a lot of people go plant-based and say they become hardcore, like they say, I watch the series or I buy a 21-day program, which is all great. I want to be encouraging. I want people to be challenged because that's how we need to change. And sometimes the challenge is good. But a lot of times, like the patient I saw yesterday, they had kale, they had like lemon, they had, some things that apple, some things that you wouldn't even think of, right? But they were sensitive to, like it comes back really high in their test. So, avocado was one. So we're trying to eat more avocados as healthy fat, right? Try to have more kale as a superfood or super green. But the more she would eat, the more inflamed she'd get. And then she's like, gosh, I don't really feel good eating plant-based. She only had like 4 or 5 things, but there's 4 or 5 things that she would have regularly. Like people have like maybe a juice with apple in them, like carrot, apple, ginger, whatever kind of thing. And so she wouldn't feel good. And then they would say, you know what? Forget this. I think I'm going to go back to my regular diet. Like this is not for me, right? My body doesn't not understand. Like it might just be a few things. So we always like to individualize the plant-based diet because your body can be sensitive to anything, plant, vegetable, grain, legume, seed, or nut, right? So it's not just saying like all plants are good. All plants are good, but to that individual, certain plants may not be. And then it's not always going to be avoidance forever. There's also going to be a way that we're going to have fixed the microbiome. We're going to get the inflammation down. We're going to get the immune system stronger. And then we're going to start rotating certain foods so the body become more tolerant to those foods over time.
And that's actually what I was going to ask you. So basically what you're saying is that you thought it was a microbiome imbalance and that fixing the microbiome will make it so that those foods will be tolerable.
Yeah. So in the before we had all this microbiome studying, we used to just do like avoidance of the food and then rotation of certain foods. And there's a way to do that. When people see me, we do that. But what happens is now we know that when someone comes back with a lot of food sensitivities, now most people in the body is going to be able to be like a few, right? Everybody's body's like, it's allowed to have a few things it doesn't like. But when people come back, it's like, wow, that's a lot of things, like a full page of stuff all over the chart, right? You plant, animal, in between. Then we have to look at there's probably some kind of gut issue. And when now the studies will show, and clinically that we can see ourselves, because that's what we do every day, is that we actually see that they have a higher rate of having leaky gut or increased intestinal permeability that then has those food proteins, even if it's plants, come into the gut, triggering these inflammatory responses. So the key is restoring that microbiome function as well as avoidance and rotating. And then they're more successful at keeping those foods in the diet, because we still want to incorporate as much plant foods because they have also phytonutrients, antioxidants, anti-inflammatory proteins, and fiber, and also they taste good. So, like if you could never eat avocado, then Mexican food would be very sad for me. So there's ways that we want to bring back some of the foods just because of the nutrient value. But then this is how we need to individualize each person's diet, not just say, hey, just go eat more plant-based. Hey, just go eat more plant-based, or just do more of this. We now have to start fine tuning and tweaking those. That's when we get the wonderful results of consultation.
Okay, I just want to get a couple of quick questions in from the audience. We've got Paul. Paul, please state your name, where you're from, and ask your question.
Yeah, Paul, I'm from New York City. Thanks for your presentation. And my basic question is, you spoke that the body can build up resistance to even the natural products. So with your products, should we be rotating on them? Bosmeric, should we be rotating on and off, or can we stay on them long term?
So you can stay on long term because of the balance of those ingredients. But I always have with all products, if someone is healthy, now if someone's like a chronic disease thing, then I want to keep the anti-inflammatory action going on all the time. But if someone is really healthy overall, then I usually do a cycle, like, just take a weekend off or take a week off and then restart it. But if they stop it for Bosmeric for a week, for example, and they still have a pro-inflammatory problem, and they'll notice it. They'll notice, like, and so that's why people are like, oh my God, it's a wonderful thing. I take it and all these things get better. And I'm like, great, fantastic, thank you for taking it. But then I say, we still have to look at, because these are people like, say, you will walk in our store, walk in our center, they haven't become a patient yet. And then I'll say, and they're like, I'm so glad you have this. So I get all the praises and all thankful. The patient's always thankful. The customer's thankful. But to me, I'm like, well, we still have to investigate why, when you stop it, you're flaring. Right? Because then over time, you need less. You might only need one a day rather than two twice a day, or 2-3 times a day for someone who's having a big flare. So, but yeah, you can cycle it, but there's no harm in taking it daily. I just have a tendency that when I'm in a less inflamed issue, like just a daily preventative, I can just take one twice a day or even once a day, just for general prevention. But obviously then I can go up more if I need more, and the patient can do the same.
Great.
Good question, by the way.
Thank you. Our next question is going to be from Karen. Karen, please state your name, where you're from, and state your question.
Hi, my name's Karen Johnson from the state of Maine, and my husband and I are plant-based, but my 32-year-old son, he has a herniated disc and a bulging disc, and he's, not plant-based, and I'm wondering, he sees a chiropractor all the time, has been for 8 months, and I'm wondering if he did go plant-based and he did, take some of these alternative to ibuprofen, the Bosmeric. If somebody like him with more of a physical issue, if going plant-based and doing alternative things might help his situation in terms of.
Great question, Karen. Absolutely. Because remember, and if you read my book and if you watch any of the videos that I've done in the past, I go into more detail, but inflammation likes to go to places of trauma, pathology, which is disease, overuse, or places where your immune system is not functioning well. So in your case, in your son, for example, if he's got a disc problem or a back problem where there's some kind of physiological problem with the, compression or, bulge or nerve compression or injury, then that's already like the damage. And then anything that's pro-inflammatory. So the more animal protein that he eats, it just causes the back pain to get worse. Chiropractic is just kind of adjusting the anatomy, but it's not fixing the physiological problem of the inflammation that's still coming in. So they might get temporary relief, but then it's like 8 months later, and I get patients all the time, like 10 years later, seeing the chiropractor, twice a month for back pain. Then I'm like, well, they're not curing the back pain. It's temporary relief. It's kind of like taking a natural ibuprofen from the hands, right? So what you want to do is, yes, having it. But here's the thing. If someone's really hesitant, and this is where, half my patients might be plant-based, half my patients are not plant-based. They're paleo, keto. They're coming in, and this kind of a tough discussion. But remember, I'm not, it's their problem. I always don't it's your back pain. That's not my back pain. I sleep well at night. So I'm not here to tell anybody, everybody has their own karma. Everybody has their own life, what to live and how well they want to live it. My job is to give the people the perfect opportunity to live their best. Right. And sometimes we have to just change our ways. So where the bargain is, and someone who's like, especially younger patients, right? Because I see and older patients. So on the spectrum, there's just going to be change is going to be difficult because everybody eats this way. Like if you're a college student, or if you're already 75 or so, change is sometimes a little bit more difficult, right? Because we get stuck in our ways. I always say, let's just test all the foods, plant, animal, vegetable, grain, legume, seeds, and nuts, and say which food is causing the most inflammation in their body from a sensitivities immediately, meaning within an hour, and a delayed up to four days later. And then when we find that foods and we remove it, some of it's going to be from the plant food, some of it's going to be from the animal food, then their inflammation burden goes down most significantly. Then they're more apt to change their lifestyle because they're feeling better, right? Without being I'm going completely 100% plant-based. That's a little bit too much of a lifestyle change. So I always kind of have this, like, what can I do to lead them in that direction of health? Once they know what their true triggers are on both sides of the realm, because we don't be like, hey, go plant-based, eat more of this. And that's also sensitivity. And they go, that didn't work. My back pain got worse, not knowing why. It might be one or two things. So once we kind of fine tune that and they lower their inflammation, then they're more apt to change their lifestyle going forward, because they're like, I don't want to have more back pain.
Thank you so much, Doctor. That concludes our Q&A session. So I want to thank you personally. You did a wonderful job, and we're going to open up the microphone so the audience can also say thank you to you.
Thank you, everyone.
Thank you, Dr. Pai.
Thank you.
Thank you.